Hello, it's Dr. Eric Potter again from Sanctuary Functional Medicine. We are doing a Facebook Live today on pediatrics. So we have had a ton of people send in questions and we are going to try to get to as many as we can. But first just want to tell you a little bit about why we take care of children here at Sanctuary. We are in Franklin, Tennessee. We have an office here. We do care for patients across many states when they come to visit us for the first time, and then we provide telemedical services like for adults and patients as well. With that though, I'm board certified in internal medicine and pediatrics. That means I did two programs somewhat simultaneously in learning how to take care of adults and kids. With that, I also certified in functional medicine, so I apply that functional medicine, whole person approach, root cause approach across all ages that I'm taking care of. With that, we approach children just like our adults, but they are not little adults. They have very different bodies that work differently, similar but differently than ours. So we are taking into consideration children at their age, their developmental, whether it's neurologic, whether it's emotional, whether it's social, whether it's their gut, their immune system are developing at different levels than, say, an adult who's been around for a little bit longer like we, myself or others. So with that, we are going to come at it with a functional medicine approach where we are treating root causes, trying to get at the root causes of what is causing a child's illness. For example, if some child is exposed to toxins and that's causing the symptoms, we want to remove the toxins, not just give them another medicine or even a natural pharmacy like an herb or a vitamin to hide that symptom. We want to remove the issue that's causing it in the first place. So with that, we are excited that we have this opportunity to interact. You may hear a lot of noise in the background today. We've got some kids in the waiting room. We've got some vacuums going, doing a little work in the back. And we have patients coming in and out outside the door. But if you have trouble hearing, let me know and we will try to address that. But for now, let's just dig into some of the questions that our viewers, our pre-viewers, have left for us to get started with. So, for Brooke in Tuscumbia, Alabama, once a child is no longer breastfed, do they need supplementation with anything? Specifically, compound heterozygous mutation. And I'm going to assume that that's referring to heterozygous compound MTHFR, which is an issue that we help a lot of patients, both adults and children, address in their health. But for children, they're weaning from breastfeeding, which we definitely support breastfeeding. There are so many great benefits to that, from preventing gut dysbiosis, preventing yeast infections, decreasing colds, decreasing all kinds of infections in infants and small children. But there is a time when, whether for work reasons or just the fact the child's getting old enough and is doing more solid foods, that child is going to wean. And there's a lot of debate over that right age. I'm not going to touch that with a 10-foot pole, but what I will say is once a child, especially infants that are under 2, are weaning, you do need to take some consideration about what supplements are giving them. Before that time, we are more concerned about helping moms know they should get vitamin D, get enough iron. They should be getting omega-3s, particularly DHA, which is the more brain-active form. We are trying to help moms know how to get babies up through that during breastfeeding and supply that through the breast milk. However, once weaning occurs, then you need to consider whether or not iron supplementation, depending on dietary sources. If someone's a vegetarian, you might need some iron. If that child is going to be vegetarian themselves, making sure they're getting adequate vitamin D and also omega-3s. Omega-3s are very important for all children, whether they're a compound MTHFR heterozygous or not. But then you get into some specific issues. For this case, well, I cannot give specific medical advice, and I do want to emphasize this. You need to take this as an educational session, learning a little bit more about some questions I can answer for you, is the fact that the child with MTHFR needs to make sure they're getting adequate folates, and not just folic acid, but actually either folinic or methylfolate, which are the more active forms. So with a child who has MTHFR, they could get that in their diet by eating a lot of green leafy vegetables. That may be plenty enough for them if they're not being exposed to toxins, and otherwise their diet is good and a low inflammatory diet. However, if you have a child who's not wanting to eat the green leafy vegetables, they're a bitter taster, meaning they hyper taste bitter flavors and have trouble with that, then what you're going to want to do is consider dosing 100, 200, up to 400 a day of, say, methylfolate. And there's a lot of good products out there that provide that in a liquid form for children. You can mix that in other liquids they're drinking, or you can just give that to them directly. So with that, we want to make sure that parents are providing the right nutrients to their children, and those are some of the things that, at least in a general sense, and the specific case of an MTHFR individual, that we want to give them. So let's see what other questions we have. What diet, this is from Joe in Lebanon, Tennessee, what diet and treatment do you recommend for children and maybe adults with ADHD, anxiety, and or depression? So that is a long and complicated answer in terms of the fact that, first of all, you have to get at the root cause. What may be causing the ADHD? What may be contributing to anxiety? What may be the root cause? And also triggering factors for depression or anxiety. So once you do that, you're going to be trying to say, oh, if it's mercury toxicity, remove the mercury. If it's a chronic infection, triggering some of that. If it's gut dysbiosis, if it's yeast infection in the gut, yeast dysbiosis, we want to treat those root causes. Now, things that will help overall most of those cases, things like for ADHD, anxiety, and depression, all can benefit from omega-3s. There are two types of omega-3s that are important. One is EPA and another is DHA. For adults with cardiovascular disease, the EPA version is a little more important, whereas on the other hand, DHA is more important at the end and the beginning of life, meaning in the elderly, it's a little more helpful for brain health, but in the infants, you want to make, and developing fetus inside mom, you want to make sure that you are getting enough DHA to allow brain development over time. So some other things you might look at, there's some therapies like theanine, GABA, that can help calm things. Depending on the ADHD trigger, sometimes you will want to use detox therapies. Sometimes you want to do different therapies that can help someone sleep a little better. Sometimes kids are not sleeping well, and that's causing some of their anxiety or ADHD. They have either sleep apnea from large tonsils, or they're just playing video games too late at night, and that lack of sleep is what's causing them to have attention deficit or hyperactivity. So those are a few of the things that we do in terms of helping children that we care for with those types of symptoms, and adults, a lot of that overlaps as well. Another question from, let's see, Carrie in Nashville. I recently found out through some testing that I have some high levels of mercury, and I'm concerned that since I breastfed my son for the first year, that traces of mercury may have been passed on to my son. Is it possible? If so, should I have my son tested, and what issues might come up in the future with his health? So that is another question about breastfeeding, as far as, yes, you can, a mom can pass toxins on to their child during breastfeeding. So earlier we talked about the fact that breastfeeding has a ton of great benefits, but this is one of the reasons why we try to help moms detox or optimize their health. If they come to us with health issues and they say, oh, well, we're thinking about getting pregnant in the next 6-12 months, I was like, well, let's really get everything under control, remove toxicities, remove deficiencies as well, making sure they're getting sufficient vitamin D, iron, omega-3s again. We want to prepare mom for that pregnancy and for the breastfeeding so that mom doesn't have a concern that they are giving their child organic toxins like pesticides. mercury, heavy metal toxins like mercury. So yes, there are some potential effects. Still, I would say the breastfeeding outweighs that unless a mom is just acutely toxic, which probably they're not going to be healthy enough to breastfeed in the first place if that's occurring. But if that child is not having definite symptoms, I can't, now again, I'm not going to give specific advice, medical recommendations, but if that child's not having symptoms, you may not do anything other than making sure they're having an adequate diet that their body can detox on its own. However, if they're having immune system disorders, thyroid imbalances, leaky gut, gut issues, you may want to consider. Now, that testing then would be directed at what symptoms they had, with the knowledge that, oh, mercury could be elevated, and you might want to consider either doing a blood or urine mercury test to determine are those levels enough that need to be detoxed, are those removed from the child's body. But as they grow bigger, whatever was passed on to them will be diluted. So your big job is just simply not allowing that child to be exposed to more mercury or tin, which is another substance that can be in fillings that sometimes leaches out into breast milk or can cause health effects. But if you're preventing, avoiding amalgams, silver fillings in your children, you're avoiding other sources of mercury, then your child may grow up with not having any long-term effects from that. Let's look next at... Let's look at another complicated question. This is from Holly in Columbia. So I'm going to read this out. Do appreciate her compliments here. My son has been losing his hair, growing it back for the past 3 years. Currently bald. We do not know if it will grow back this time. Also experiencing other symptoms such as allergies, eczemas, hives, baldness, hoarse voice, constipation, diarrhea, headaches, dark circles under his eyes. Body aches, extremely emotional, gets hot very easily, cannot finish his sentences. Most recently, his tongue has been tingling and eats certain foods. Any advice or insight? Well, I can't diagnose just from that story because we are going to, at our first visit, spend an hour and a half with that patient, 45 minutes to an hour actually doing a history, digging into past medical history, their full health story, doing an in-depth physical head-to-toe exam, and then talking through the different testing options and recommendations that we make in that visit before we have them come back and discuss that 4 to 6 weeks later in another 90-minute visit about what those results point to and show. With that in mind, the things that come to mind hearing this is mold toxicity is something that could trigger a lot of these symptoms. It can definitely trigger the allergic type symptoms of asthma and allergies. It can trigger autoimmune symptoms, whether it's Hashimoto's, whether it's hair loss where they have alopecia. So that is another, mold toxicity is another possibility. One of the things that we look at is H. pylori in the gut can potentially cause an autoimmune issue in which hair loss occurs. So you may want to consider H. pylori testing if you have a provider that can provide that. So otherwise, there's a lot there. That's where I would start with looking for toxicities and deficiencies and hormone imbalances for a child if I were seeing that patient in the office. So another question from Joe in Lebanon was, for a child with eczema, would you be suspicious of food allergies or gut problems? So, when a child comes in, we're going to do that full in-depth history and physical. We are going to look for all the different possible sources. We see a lot of children with eczema. We have seen many children come in where 70–80% of their body is covered with eczema. They're miserable, they're itching, they can barely sleep at night, they're scabbing, they're getting skin infections. And we look for what are those root causes, whether it's a toxicity, say something like mercury, whether it's an infection, they have yeast infection on their skin that's triggering this, or in their gut, whether it's deficiencies, whether they are very low in omega-3s, which makes that eczema worse, or the fact that when you have that severe of eczema, you're actually losing your fatty acids. So you may need some gamma-linolenic acid, which is an anti-inflammatory omega-6. You may need some more omega-3s, such as EPA or DHA that we talked about earlier. With those, you're able to settle down a lot of the inflammation and help patients recover as you're searching for those root causes. So that's another thing I'll just take a moment to talk about is you may think, oh, well, great, I'm going to come see Sanctuary and they're going to spend 1, 2, 3 months searching for root causes, and they don't want to just treat symptoms, and somehow we're going to have to wait, and if we don't get an answer right away, we're going to be suffering. I do want to make clear that we will do our best to cover, in the short term, help with those symptoms. So like this, for example, for eczema, we are going to do those things that would help the eczema while we're searching for food allergies, where we're searching for toxicities or other issues that might be causing that. So some of the examples we would look at, like I said, omega-3s. We may use some anti-inflammatories like curcumin, which will help. If we're suspicious for leaky gut, we may do a lot of leaky gut therapies using antibodies that bind antigens in the gut, allowing them to heal their gut. So we'll talk about leaky gut in a minute, but basically that is an issue where there's some foods or antigens passing into the immune system, and that can trigger some eczema or allergies or other symptoms. So with that, we're going to try to help calm down those symptoms. It might be using some anti-yeast soaps. It might be using some anti-yeast herbs if that's a suspicion. We may even, believe it or not, yes, hold on, we may even use some antibiotics. So actually pharmaceuticals. If we have someone who's got a severe staph infection and they failed a lot of other therapies, we may say, you know what, we need to get this settled down. Once we get this settled down, then we can come back around and use those natural therapies that may take 1 month or 2 months to have a really good effect. We want to get them feeling better, going back to school or homeschool or whatever it is, playing their activities without having these symptoms. And then we can use those longer-term preventive therapies so that 3 months, 6 months down the road, they're not having this repeated. And we see, we have several patients who have come back now, and that 80% eczema coverage is now down to maybe 1 to 2%. They just have a few little patches here, and they can sleep at night, and they're not itching all the time, and they're not flaking, leaving skin peeling around everywhere. So they're very excited about that and having their life back. Before I talk a little bit more about leaky gut and the fact that it does occur in children, I do want to mention that if you want to leave a question, you can leave questions. I have someone monitoring that so that we can answer questions that are being asked in real time. And if you want to leave questions later, think of them later rather than right now. We will be watching this and try to get to some of those other questions later. Also, if you'd like to know more about what we do at Sanctuary, or you're considering calling us for an appointment, our number is 615-815-5941. We have staff who can answer that phone and help you understand a little bit more about how our programs work. Now, moving back to leaky gut, many of you may have already heard about leaky gut. It is something that's becoming more understood even in conventional medicine. They even have the name, the scientific name is more intestinal hyperpermeability. Basically it means instead of your gut wall being nice and tight where nothing can get through it, there's starting to be leaks between the cells so that antigens, which are mainly proteins but some carbohydrates as well, are going through that inside into the immune compartment where your body's responding to that. Inflammation results from that. You can see increased allergies. Your liver starts having to filter out some of the toxins that may come through. And as that's triggering, those immune hormones, they're spilling out into the peripheral system or triggering inflammation. They may trigger eczema. They may trigger autoimmune disease, whether that's in kids or adults. One of the things, the connection with eczema is the fact that most people think of eczema being related to immunoglobulin E, a type of antibody that our body uses to fight against allergies and also against parasites. However, In eczema, we've seen a number of patients, and others that do this type of medicine will tell you that IgG, immunoglobulin G, the type of antibody that typically is more for fighting off viruses, bacteria, invaders, and infections, that IgG elevation to a specific food, when we do food testing, may be what's triggering eczema. And we've seen a number of those patients when you remove that food, even though there's no IgE, the typical allergy antibody that most allergists would look at, and they would dismiss the IgG. We've had a number of patients where doing the testing, finding IgG, removing that food, we do feel pretty confident that that played a significant role in that patient's recovery and the eczema going away. How do you know that? Well, number one, we stopped that food and symptoms lessened. And often we will have a re-challenge after 1, 2, or 3 months. We'll say, well, let's go back and try that food again and see what happens. That patient eats the food, the eczema comes back, they stop the food again and it goes away. It's a pretty good case that that is a trigger of that patient's eczema. Now, sometimes when we are healing leaky gut, those food allergies have to do a lot with leaky gut. We heal the leaky gut. We have a number of patients who can go back and eat some of those same foods again and not have trouble, but that's something we walk through with them and try to determine whether or not they can do that. So leaky gut plays a part with eczema and probably a big part with the allergic march. The allergic march is meaning that children who start developing some type of allergy, whether it's food, the peanuts, whether it's to different foods, milk or soy, once that system is revved up, you're opening up that leaky gut, there are more opportunities for things to get in and trigger more reactions. So people, even if the food allergies fade away, often end up with having more the sinus, the hay fever, the eye allergies, whatever it is, they will develop more and more allergies. So our goal is to catch it early in children, not wait till somebody's 30 or 40 and they've got 5 or 10 different allergies, but to catch it early and turn that back to where they're not developing more and more allergies down the road. So let's take someone left, Karina, left a question. My girls and I are all compound heterozygous MTHFR. Also have hemochromatosis. Nursing my youngest, and I don't take iron supplements. Take prenatal without it. Does she need more iron? So this is, again, I want to be careful and not try to provide direct medical advice or medical recommendations in this, but I can say that the MTHFR, again, something we deal with a lot with, really doesn't have much effect in terms of iron. She is referring to hemochromatosis. If for those of you who don't know what that is a genetic condition in which someone's ability to absorb iron from their food and hold on to it into the body is greatly enhanced. And you think, oh great, that keeps from having anemia, and actually women with hemochromatosis do have lower rates of anemia. However, the problem is, like much in our health, is you can have too much of a good thing. Meaning that if you have too much of a single vitamin or too much of a single mineral, you can get sick from that. There's many cases of that. In the case of iron, if you're absorbing and holding on to more iron due to this genetic hemochromatosis, what can happen is you start storing that iron in body tissues that weren't meant to be iron storage. One of the first places is the liver, so you can have liver inflammation. One of the other places, it can go into reproductive organs and potentially interfere with reproduction, fertility later in life. It can affect the skin. It can affect a lot of different places. So for her, she is trying to limit her iron, and everybody's like, well, why isn't she taking iron in her prenatal? Well, she wants to limit that. She's been given wise guidance in the terms of keeping that down. Could potentially harm her. Then the question though is she between a rock and a hard place in the fact that she is trying to breastfeed a child, yet she isn't taking iron in? Well, some of that depends on just keeping a close eye on her ferritin and her iron levels. Those are blood tests that tell us how much iron. If she has got enough in her blood, from having hemochromatosis, she is likely giving a decent amount to that child. Now, if there's concerns, you could always give some iron drops or have their pediatrician check their hemoglobin, or, which is typically the way we do on children, check their hemoglobin level. You'll have a good idea if that child is getting sufficient. Also potentially looking at their MCV, which gives a good estimate of how much iron is in the blood cells based on how big they are. So with that, yes, she can give probably sufficient iron to her nursing infant, but if you want to be a little more sure, you can have some tests done by your doctor, or if they were seeing us, that would be a possibility. So with that, and the mom might also want to have her own iron levels checked. If they're high enough, she's probably not got a lot to worry about, but we want to make sure that those levels are staying appropriate. So thank you for that question. Let's take another question from the previewers. So this is something that we've talked about a little bit already, but it's another take on it, another perspective. Is from Joe, is an elimination diet the best way to figure out the possible food intolerances and sensitivities? Are allergy test helpful? So I referred to IgE and IgG a little while ago. So food elimination trial, first of all, is where someone says, okay, I think I'm reacting to a food in my diet. I want to get rid of that reaction and prevent further issues. So the first thing they can do is cut out certain foods. Like, well, what foods do I cut out? There's, 100, 200, 300 different foods. Which ones do I cut out? Well, there's a few that are more higher up on the list. Things like dairy, gluten, grains, the wheat, the soy, eggs, peanuts, other tree nuts, shellfish, fish. Those are potential triggers that are more common in number, although we have patients who have severe reactions to lettuce or cucumbers, or anaphylaxis with a carrot. So it is not just those primary most common ones, but those, if you're just going to do an elimination diet, those are good places to start. Now, just as a side note, make sure when you're doing elimination diet that you are getting other sources of potentially absent nutrients so that you're not causing deficiencies rather than just discovering what those root causes, those food triggers are. What you do is that diet for 1, 2, 3 months, depending on what symptom. If it's a symptom that may go away, you want to probably at least do that elimination trial for about 4 weeks, just because antibody levels or reactions will go down in that time, typically. But if you're looking at something, say an autoimmune disease, Hashimoto's, thyroiditis, where antibodies are attacking your thyroid, you may want to wait 4 to 6 months before rechecking, because those antibodies may take a few months to go down, and that you really want to see if you're improving. And typically then, say at 4 months they are improving, we'll check again in another 3 or 4 months to make sure we see two numbers that are going down, rather than, oh, it went down but it went back to where it was, and that's not really a true beneficial response. So what we do is we will work through that with patients. Some choose to do that rather than blood testing, and we'll talk about that in a moment. But that elimination diet helps them determine, okay, did cutting out those foods, that group of foods, help in any way? If they get better, they're like, okay, maybe suspicious one of those are, but you don't know which one. If you cut out 7 foods, was it number 1, 2, 3, 4? Was it number 2, 4, and 5? Or was it coincidence? So one of the things we'll do is have patients start reintroducing those foods every 3 to 7 days, depending on the situation. If somebody's having rashes with foods and they stop those potentially offending foods that group I listed, and the rash goes away, after a few weeks we'll say, okay, try, say, soy. Eat it for 1, 2, 3 servings over a day or two. Watch for 3 to 5 days, and then see, okay, did that rash come back? If it does, it's suspicious, so you'd stop that food again, wait 2 to 3 weeks. If it goes away, try that food again. If it happens again, that's possibly one of the foods that may be doing that. Now, keep in mind, some of these reactions may be something that only happens 3 out of 4 times you're exposed, so we do like patients to eat enough of that food, like 2 bites of a food, and say, oh, well, it didn't cause a reaction. Well, you may have needed to eat a whole bowl of it to trigger that reaction that we were looking for. So do keep that in mind. We go, if somebody doesn't have a reaction for 4, 5, 6 days, we'll say, all right, add another food in there, see if you have a reaction to it over 3, 4, 5 days. And they will go through that, often finding, yep, food number 1 was good, food number 2 caused problems. You gave a few days, you tried food number 3, no problem, food number 4, problem. You just keep working through those. So that can take, a few months possibly to determine which foods might be causing issues. So on the other hand, a lot of patients, for the sake of either they've tried an elimination diet and haven't been able to figure out which one it is, they will come back and say, okay, could I just do some testing? I just want to know, blood test. Let's just get the answer. Or they may say, listen, I don't have time for this. I don't really have time to figure out my diet over the next 3 to 5 months. Let's do a test and let's get a head start. And that's really what I feel like it is a head start. We do IgG and IgE. I mentioned earlier that IgG is more the invader viruses, bacteria our bodies are trying to fight off, whereas IgE is more involved in the allergic system and fighting off parasites, worms and protozoa and things like that that may be in our body. But we test both because they're classic allergies where if somebody puts a peanut to their mouth, their lips swell, their tongue swell, they can't breathe. It's usually pretty easy, but occasionally we'll see some low levels and people don't realize that in their gut they're having some histamine release. But we'll also check IgG. Typically that's the more delayed. Someone may eat something, and one of the reasons why we wait a few days after we redo that re-challenge phase in the elimination diet is if you've been off something for 2 months, you go back and eat it on Monday, you may feel fine until Wednesday afternoon and all of a sudden start having a belly pain or headaches or a rash. So the IgG may take 2 to 3 days, 48 to 72 hours to have those symptoms show up. So we want to make sure people have a fair shot in knowing whether that's causing that. But it's also one of the reasons why somebody comes to us and like, listen, I tried cutting out tomatoes and couldn't tell any difference, but then I eat one day I eat it and it's a problem, and another day I don't. And if I eat 3 slices of pizza, I have problems, but if I only eat a small piece of pizza, it doesn't seem to bother me. So yes, there's going to be elements of which the amount, and even if you eat the same amount, one time it does, one time it doesn't. There's a lot of other factors that may tip you over the edge. So patients have difficulty finding out which one of those foods might be doing it. So we can help them with that testing and get them a little bit further along in their ability to know which foods are triggering symptoms, whether it's autoimmune, whether it's eczema, whether it's migraines, whatever it may be. So what we're trying to do is compare, depending on what so this is an example where we're going to sit down with a patient or their parent in case of pediatrics and say, what are your preferences? If you'd like to try the elimination diet, you haven't done that before, and you'd like to avoid, $180, $200 cost of testing, they may want to try that. However, others may say, listen, I've gone through all this, I just want to get to the answer. We need to get to the bottom of this. The symptoms are too much. We'll go a little more to the testing. Still, at that point when we say, oh, these are the 5 foods that have triggered a reaction in you, we will say, let's cut those out. We still go through an elimination trial, but it is more of a directed one. So instead of saying, oh, let's cut out dairy, eggs, soy, gluten, corn, and coffee, and we say, oh, well, you didn't test positive to these 3, let's just avoid these and see what happens. So it is an extra piece of information in the puzzle. So let's move on to another question, one that just came on from either Leela or Layla. Forgive me if I'm mispronouncing it, but 10-year-old son recently developed a couple of mild motor tics, read several theories as possible causes for this. Everything from TMJ issues to MTHFR to pandas to food allergies. Trying to find... Hey Stephen, can you help me get the rest of that comment? But I will go ahead and answer a little bit on there. I can't read all of the rest of that on my screen, but basically motor tics, what might be causing this? Motor tics are going to be a neuropsychiatric symptom. typically from a irritated, agitated, hyperactive brain area. So it is something is poking at the brain, either causing a desire to do these tics or an automated desire where it's just happening. So yeah, some of the things you have mentioned there. PANDAS, Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep, or PANS, Pediatric Autoimmune Neuropsychiatric Syndrome, more just any infection, or actually even mold toxicity can play a part in that as well. Other infections besides strep are the more common ones. Those are all things that could be triggering that. Can be also some emotional things. If there's a child is having some trouble in school situation, they may be expressing anxiety in that motor tic. That may be just like we talk about, some people when they get stressed, they get stomach aches, some people get headaches, some people get itchy, break out, other people get pain in different places. So with that, we would want to dig into the story a little bit more, well actually a lot more, to really understand what are the other clues. So when we see a patient, one of the things we do, especially more for adults, but can be for kids as well, we want to learn about what's been done, what worked, what hasn't. Sometimes the best clues are, well, we tried this therapy and it didn't work. Or we tried this therapy and it caused side effects. Sometimes that helps. Oh, I bet that metabolic pathway is either genetically or due to a toxin or deficiency is diverted. So we can often sort out what is the best root cause treatment and short-term treatment, as I mentioned earlier. So kind of the rest of that question that Stephen helped me with was, have you treated kids with this? And if so, where do you start and what recommendations? So kind of start looking with a good history and physical. Are there things that we can tell in the history? If the child was, we've had patients who found out the parents moved out in the country. Oh, we're safe, we've got a creek, only to discover their child was playing in a condemned creek where pollution from an upstream factory had occurred and had heavy metals. So that child experienced heavy metal toxicity. You may find out, oh, well, great, we live out in the country, but you learn that all that you're in the lower part of the land and all your neighbors are spraying pesticides or doing crop dusting. You may find out there's some pesticides, glyphosate and others that the child or you yourself are being exposed to. So first of all, we're going to want to know what is that trigger. So we would consider testing, like I said, a number of things. Infection, PANDAS, you're going to look for strep antibodies. You may look for other antibodies to other infections because it's not just strep. So let me take a moment to talk about the Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep. As you can see, there's a reason why we call it PANDAS. It's just much easier to say and get that out. So with that in mind, though, it is a situation where an infection, typically, has triggered your body to respond to that infection, attack that infection, but your body's also attacking some part of your tissue, whether, in other diseases, maybe joints, maybe skin. In this case, it's attacking brain tissue or nerve tissue, and specifically in the brain, so that way the child is having either obsessive compulsive symptoms where they're having to go back and wash their hands 30 times, or they can't go to bed at night because they're worried about the doors being locked, or they may be having panic attacks where out of the blue, all of a sudden, just after a sore throat, a week or two later, they are just completely losing their mind in fear and anxiety. It can also be potentially motor tics where they're having some motor abnormalities, mood disorders, depression or anxiety, even kind of paranoia, which sometimes they get lumped into that from some of these compulsions that they have to do things over and over again. So those are some areas where we would start. We see success in those kids. We help them both turn down inflammation that is affecting the brain tissue and also trying to remove those triggers. So once you remove the triggers, you turn down the inflammation, the brain can heal, and you give it the nutrients that it needs to heal. So it's a very multimodal approach, helping parents learn how to live a low inflammatory lifestyle, so they're not they and their children are not eating high inflammatory foods like processed foods, artificial dyes, and coloring. So let's go on to another question. This, just a reminder, there's a number of questions we've answered along the way. If you're watching this later, just coming on now, we've talked about breastfeeding, supplements for children after weaning. We've talked about treatments for children and adults with ADHD and anxiety or depression. Talked a little bit about MTHFR, whether or not mercury could go from a mom into the breast milk and into a breastfeeding child. Talked about some complex issues with allergies. Talked about leaky gut. Those are all things that are earlier on. So let's move on to the next question that Becky talk a little bit about how mold treatment would differ for a child versus an adult. And after remediation or removal of the mold, of course. So it's, always the fact that first you have to get someone away from the mold. So it's exactly the same for kids and adults. If a child's being exposed to mold, you need to get them away from it, whether it's school, whether it's home, whether it's any place they might be spending time in that's enough that they're being sick from that. But otherwise, a lot of those therapies are going to be very similar. Now, of course, you're going to look at a child and say, oh, they need a smaller dose than the adult does. So that's pretty much given in any pediatric standard therapy, whether it's an antibiotic or an herbal or a vitamin. We're going to dose based on size. From there, we're still going to use a lot of those same detox mechanisms. We're trying to open up as many doors to get rid of mold toxicity, whether that door is in the stool, whether that door is in the urine, or that door is in the skin with sweating. This is one area, though, the sweating, where we might have a child play outside and get sweaty and then rinse off so it washes off toxins. I usually would not recommend a child sit in a sauna where they might get overheated and there's a chance of side effects, whereas adults who have the ability to kind of self-monitor would be appropriate for a sauna therapy. Kids, good sweat exercise therapy often helps if they're able to. Otherwise, a lot of the supplements, besides the dosing difference, we're going to be using the same things, opening the same doors, using a lot of the same therapies of support that help to lessen mast cell histamine issues, help to lessen inflammation, help to heal leaky gut, which often happens with mold toxicity. With that, the biggest difference, though, is the outcomes. Children often get better quicker. Maybe just removing that mold exposure, they end up getting better in the next 1, 2 weeks or a month. Whereas adults, if they've been exposed for more years, maybe that's built up, their health is not as good, their nutrition is not as good, they don't sweat as much because they're not outside playing like the kids are. They may take a few months, often do. Whereas kids, in a month or less, they may be bouncing back and doing great. So just want to let you know that that's probably the biggest difference. Otherwise, there are a few therapies you have to be a little more careful with in smaller children, but for the most part, they overlap a whole lot. So thank you for that question. Let's try to get some other questions in here. What would your baseline supplements for children under 13 be? And please recommend brands. Or do you recommend a multivitamin? So, good opportunity just to, and this is from, thinking this seems to be, I think it's from Tina. Tina in Centerville. So, thank you. Some of the baseline supplements is we want to make sure kids get starting with the dietary things, not just jumping to vitamins, is low inflammatory diet, cutting out the processed foods, eating organic according to Environmental Working Group. So not all vegetables and fruits have to be perfectly organic. If they've got a peel, a lot of them are safe, or some of them can be grown without a lot of pesticides, and they're not genetically modified. So you can get them just the regular old plain old vegetables where you're not worried about having to pay the extra organic fee. But from there, if someone's doing well on that diet, it's not always necessary that they take, say, a multivitamin or iron or omega-3s. With the omega-3s, though, that is one area, omega-3s and vitamin D, that I often say, go ahead and supplement some with that. We use Nordic Naturals for our omega-3s, whether it's adults or kids, for our fish oils. Also vitamin D. We have several different brands, from Seeking Health to Nordic Naturals has a good vitamin D, but we want to make sure they're getting D3, that's the best active version, and more so for adults, but a little bit for kids, getting K2, which helps them put the calcium that the D3 brings into the blood, put that calcium into the bones. So D3, omega-3s if they're not eating enough fish. But if you're eating 2 or 3 servings of fatty cold water fish a week, we have many patients who have very high levels and they don't take supplements of omega-3s. So it all depends on which are the best depending on the patient's health. If it's great, it may be very limited. If their diet's great, it may not need other things. Now, someone's gluten-free or completely grain-free, they may look at wanting to get some extra B vitamins because that is one of the places you get a lot of the B vitamins. I think that answers that question. Let's go into another question. Can children on the spectrum get help with functional medicine? So autism spectrum disorder is basically a condition that we don't fully understand, but which the brain doesn't function as well. And children have a lot of trouble with learning, with speech, with social interactions. They may be very bright, intelligent wise, but they're not able to interact with their social environment or relationships. Causes a lot of strain on the children and also for parents. So yes, there are many ways that functional medicine can help. As a good way to start would be saying, a lot of people say if you've met one child with autism or autism spectrum disorder, you've met one child with autism spectrum disorder, because there's probably a little different cause in each child. And that's one of the reasons why we haven't probably found that one magic cause that explains all of autism. In some patients, we feel like it has been affected more from chronic infections and treating those that we've seen improvement. Sometimes it's been triggered by toxin exposure from either vaccines, from chemicals in their environment. We may look and say, oh, we need to remove those toxins like aluminum and see improvement. Sometimes it is simply lowering inflammation through a low inflammatory diet and other anti-inflammatory supplements, and we will see patients start making strides forward, start interacting, start speaking, stop having so much trouble at school, and see lots of improvement. So it is something that we deal with a lot and have seen a lot of success with. Again, it's unique for each child. We have to determine what is probably contributing that for that child and aim our guns at that issue, not just a blanket, here's the top 10 things you do for a child with autism. There's a couple of questions from two different viewers about bedwetting, either in a 9 to early teen middle-aged child. What are some potential possibilities that might be causing this? With bedwetting, you want to look, one, are there emotional triggers, so going through the major changes in life, are there some reasons why the kid is either sleeping too deep, or are sleep apnea might be triggering release of urine, where they're kind of not breathing well at night and it's causing them to urinate. Whether they're having night terrors, whether they're having seizures. If they're not during the day, it's probably not that. But thinking through those things is we would always do a good thorough exam and evaluation. Beyond that, we start looking for things, whether it's the pandas we talked about earlier, where the brain is being affected and they may not have as good a control of their bladder. You might want to look for bladder size if they are having other anatomic abnormalities, if they have some other dysfunctions or neurologic issues in the groin area, about controlling bowel habits as well. We can also sometimes, when we've ruled out a lot of other things, we'll look at mold toxicity. It affects the body's ability to control your fluids, and a lot of times children will have more urination at night because the mold toxicity is affecting their ADH, their antidiuretic hormone, and they can't hold that fluid. So we start everybody out with cutting fluids back at night. We consider the causes, we consider whether or not medications might be helpful, and we try to walk through that process over the comprehensive treatment program and get a child, whatever other symptoms they're having, address those. So this is the million-dollar question that everybody's probably most wondering, or possibly wondering about, is how do you get your kids to like vegetables? So I don't have a magic answer on that one, so I don't want to get anybody excited that all of a sudden they've got the answer for their kids' vegetables problem. But I will say it's interesting that there are some genetics in which some people are hyper bitter tasters, meaning they could eat vegetables and they will have a very much more intense taste. So if even some of you parents are out there listening and like, oh yeah, that's me, I never liked vegetables because the broccoli tastes like somebody just poured a whole bushel down my throat. There are situations, there are some taste tests out there that you can do where you can find out, are you a hyper bitter taster? And those children legitimately have a little more stronger flavor, and you may want to look at being less likely to give them raw vegetables, which are stronger, and doing more of the steamed or somewhat cooked vegetables that lose some of that flavor, or find other ways to hide that flavor. But legitimately, some kids have a hyper bitter taste. But other kids just need some encouragement in making sure that when we all take a little while getting used to a new flavor, if we don't have immediate like of it, kids need to be exposed a few times before they are given a chance to completely say no. So you can work with your kids in that, but if they're a hyper bitter taster, there may be you may just have to be pretty creative about hiding those vegetables in other casseroles and smoothies and so forth. So, Anara, thank you for the question about, is there an anti-inflammatory protocol that you prefer? So it all depends on where the inflammation is occurring. We use a variety of therapies from curcumin to boswellia to ginger to antihistamines can help lower inflammation. It can be just removing inflammatory triggers. So if dairy, a high amount of dairy can trigger some inflammation. If someone's having inflammation from gluten, if we find out someone's having mercury toxicity, we're going to remove that trigger. So there's not one protocol. It's going to be a little different for each patient, adult or child, that comes to see us. Thank you for that. We talked about multivitamins. So here's a good, with all the toxins, this is from Taylene, with all the toxins in our world today, both inside and outside our homes, what is the best, safest way to help our children detox, especially if we suspect a methylation issue? So with that, yes, you're correct. We are faced with a lot of toxins from plastics, from metals, from organic solvents, from mold, because we build our houses so tight and poorly constructed that allows moisture to build up and have mold growing. But even without mold, there's plenty of toxins from VOCs and paint, new furniture you bring in. How do you help your child detox? First of all, is you want to keep as few toxins going in as possible. Sometimes that's easy, you don't know they're there, or you do the best you can. With that, then, once you say, okay, how do we optimize a child's detox system? One of the things we're going to do is look at making sure they're getting plenty of protein. Many of the mechanisms, well, all the mechanisms require enzymes, which you need protein for. That protein helps them process that. We use a lot of the amino acids from protein to attach the toxins so they get flushed out. From there, you want to make sure they're getting plenty of B vitamins for the methylation cycle. So if you don't know their MTHFR status, you may look at just a low dose of methylfolate in a multivitamin, not folic acid, for a number of reasons. We won't get into that now. But if you're providing good nutrition, adequate protein, adequate energy sources, healthy fats in terms of the omegas, the cold water fish, again, the omega-3s, you're going to see that child be able to do a pretty good job of detoxing, probably a little bit better than us. The bigger issue kids have is they have a small body area, and that same amount, a gram of toxin to them would be more like 5 grams to us because we're a lot bigger. So it's not as much their inability, it's just more the amount of toxin is relatively a little more overwhelming for them. So those are the things you can do. Make sure your house is well ventilated. Make sure, consider an air purifier, dehumidifiers, things to keep the toxin load down, avoiding plastics as much as possible, limiting exposures if you have the choices to use different paints, or if you are going to paint in your home, let it air out before you are living back in there, or if you're bringing new furniture in, maybe let that sit out in the garage and air out a little bit. As long as you don't have a moldy garage, then that would be a bad idea. But airing out some furniture before you bring into the home and have those new smells. So those are some of the ways that you can help with kids in detox. I think we're going to have, we are coming down to the end of things. There's going to be a few more questions that I will try to post later in either little audio, videos or on the Facebook below. But for now, I just want to take the last few minutes to talk about a little more about what we do at Sanctuary. We offer comprehensive treatment programs where we are taking 5 to 7 months to work with you or your child on your health issues, helping to find the root causes. We are doing an intensive functional medicine approach. I specialize in adults, children, and functional medicine. I've done extensive training with Seeking Health MTHFR educational process, and I'm always looking for different sources. I've learned from many places, and my staff who serve with me, physician assistant nurse and nurse practitioner, we have learned from a lot of different areas, and we put that together, and so we have a team. We have a team-led approach, especially when we combine our nutritionist, Kira, into that mix. We are able to provide a lot of services under one roof and really get at the root cause of you or your child's illness. With that, we have programs because we know that patients are committed to a process when they've been sick for months or years. They're not going to get better in a week. So having 1 visit, 2 visit is not going to be enough to really see progress. So we want patients to live a healthier, more abundant life. We want children to have a healthier, more abundant life for decades to come. So we take that time, we ask for the commitment from you, and we make that commitment to you that we want to walk with you through this. So we're looking forward to any of you. If you have more questions, we have a website where you can do a contact page or give our office a call at the 615-815-5941. Our website is sanctuaryfunctionalmedicine.com. We'd be glad to help your child recover from chronic illness that they may be facing, unexplained symptoms. So thank you for joining me. I hope you enjoyed this and it was beneficial. For those of you may be listening later, if you want to leave other questions, we will be watching this and try to answer other questions over the next week or two up until the next Facebook Live video that will be in a couple of weeks. And let me just let the topic then will be cognitive health, and it's going to be at 11:30 on the 23rd. Just due to scheduling, it's going to be easier to do that at 11:30. So I look forward to hearing more from you, and I hope everyone has a blessed day as we end the summer. So thank you, and have a great day.